mentioned something about specialists earlier, something about online. Can you tell more about that? Like, what does that do for you, and how much do you utilize that type of thing?
Sure. Yeah, so I think Emily mentioned some too about a service that we use called RubiconMD. So this is something that most DPC docs, or I would say many DPC doctors use. It's an online clinical consult service. They have about 100 different specialties. The physicians actually pay for this, but then use this most of the time as an added value to their patients. So I had a patient the other day. She came in 2 months postpartum. She was having some weird symptoms, some joint pains. She hadn't lost a bunch of her pregnancy weight. We did some labs. She had some weird thyroid numbers. Sent that off to an endocrinologist and a rheumatologist. She also had a positive ANA, which that's like everyone's worst nightmare. So what do I do with that? I'm the family doc. Well, I went and looked it up on UpToDate, and I came up with my own conclusions. But then I had an endocrinologist and a rheumatologist say both, this doesn't really look like this is, primary rheumatology. This looks more thyroid. And the endocrinologist said, this really looks like postpartum thyroiditis, and I would manage it in this way, and the patient doesn't have to go see any specialist. And we're monitoring her TSH for $1.70 every time we check it. So that's kind of an example of how we use that online clinical consult service.
That seems better and cheaper than what usually happens.
Yeah. And the patient said thank you. So that was, it's exhilarating. It makes doing actual medicine fun, because I get to give great service to a patient that I really care about, and they really appreciate it, and it makes it worth the $45 a month that she pays at my office. So
awesome.